Colin, what, based on the research, and I know you're a thinker and a doer for a think tank here, what do you see as the biggest impediments to reform? You've got a whole poll that showed reform is not only necessary, but is being starting to be embraced by the general public. What stands in the way of those reforms?
I would say there's probably two things, Tony. One of which is, in some cases, legislation, giving patients that choice whether they want to use the public system or pay out of pocket at a private clinic. In some cases, there is legislation in place that is blocking that. So right now, there's a famous case in British Columbia where a private clinic is challenging this ban essentially in the courts. In Ontario, there's legislation that bans private hospitals, private clinics from doing the types of things that we're talking about. The other challenge is it comes to politics, just governments being willing to move forward with, in some cases, allowing some of these reform measures to actually happen. So those would be the two challenges. I think on the political side, for a long time, this was more of a touchy subject. It was difficult for politicians to talk about reform, but I think, 20, 30 years now, a lot of organizations and people pointing to what happens in Europe and Australia and New Zealand and other models where patients are getting better results. I think the public's starting to understand that, we can keep what's near and dear to our hearts here in Canada, and that is this notion of a universal system. But at the same time, we can reform it and end up with better results so that patients end up with better healthcare.
Yes, you raise a good point that Canadians shouldn't automatically assume that because our healthcare system is structured this way, that is the only alternative to the American system, which they know very well or think they know very well as well. So, talk a little bit about the European and the Australian experience with their healthcare systems.
Well, like I said, I mean, one of the key differences is that they give patients a choice. You're not stuck using the government monopoly. There's more competition in these countries, and competition helps lower costs. It leads to innovation, yeah, all kinds of different services being offered. So that's some of the key benefits from those countries. They also have more doctors per capita. They have more beds per capita. They have more nurses per capita because they don't just have the one system. They have two systems. So you end up with more resources. So those are, I would say, are some of the benefits from European healthcare models. Same with Australia, New Zealand. There's lots of countries that we can look at to reform and learn from. But too often what happens is there's the political side too. And it's not just the elected. There are special interest groups that want to preserve the monopoly because it means they don't have to compete. They can pressure governments and try and get what they want. And largely, this is often public sector unions that oppose change. So they're actually holding our country back when it comes to learning from other countries that end up providing better services. So, it's a challenge politically, but I think the tide has turned, and I think it's turned actually for a little while now that the public is there. They're ready to embrace these new changes. But we just haven't seen really the political side catch up yet.
Yeah, I'm glad you mentioned the public sector unions because that was another impediment that I was going to raise, that they can be resistors of change. Of course, if there are private sector providers, they tend to be non-unionized.
Mhm.
And so you've got that clash as well. Can you expand a little bit on that?
Yeah, I think it's in a way it's pretty straightforward. When you don't have unionized workers, then the unionized workers aren't paying union dues to fund the union. So then the union
Yeah.
gets very upset because it wouldn't put them out of business, but it will reduce the amount of money that they have to pay for the everyone that works in the union. So really, it's not about putting patients first. I think it's about unions looking out for their own interests and not even the interests of their members. Because if you're a member, you would want more choices in terms of where you could work and maybe find a better employer, whatever the case is. So like I said, I mean, really, if you're putting patients first, you want to give them lots of choices. You want a system that has competition, so that's leading to innovation. It's leading to a more cost-effective system, which helps improve the sustainability of our healthcare system. So really, I think we could be looking to Europe more at some of the things that they're doing over there. Same with Australia and New Zealand. And ultimately, that would lead to better results for patients. Because when you look at international scores, we're not at the top. There's a report recently by the Commonwealth Fund, and they looked at 11 healthcare systems, and Canada came in 10th, the US 11th, and there were a whole bunch of other countries ahead of us. So why we would look at the US, I don't think it's the model that we want to need to
Right.
be looking at. I think we need to be looking at some of these other countries that are top performers.
We're going to take another brief break. We'll be back after that. Please stay with us.